Now, if you're someone who has had a knee replacement, then the thought of squatting probably feels very intimidating. You're probably wondering, is my knee safe enough? Is it okay to be squatting? Or will I ever be able to squat again after surgery? Well, in this video, I wanted to show you how you can squat after a knee replacement, and most importantly, show you how you can take your squat looking like this to more looking like this. Let's get started. Welcome back to my channel, guys. It's Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. So today we're going to be talking about a topic that I often get asked, especially for my patients who have undergone a knee replacement. These are for the individuals that are very active. Maybe they're going to the gym before their procedure, but they want to know, is it safe to be squatting, or can I be incorporating some squats? Will it damage my knee surgery? And the simple answer to that is no, it will not. You can completely incorporate some squats in your routine. This is not only a great exercise to help build the stability and strength in the knee, because it's going to be really targeting the glutes and the quads, which are very important for knee rehab. And so not only is this a great exercise to help build strength in the leg as you start progressing and getting more involved in more activities that are more challenging, but it's just a functional activity that we should all be able to do after your procedure, especially knowing that when you're at home or when you're out in the community, you have to have the ability to go up and down from various surfaces. And I mean sit up and down from low surfaces, high surfaces, without any limitations. And that's why knowing how to squat properly and knowing what prerequisites are required in order to do this safely, you can really start to improve the independence and the strength in your knee. Now, before we jump into a few exercises that can really help you develop this squat pattern and how to do this correctly, we have to go over what are the requirements in order to squat, okay? So the first requirements that we wanna make sure that we have is adequate range of motion. And I don't mean just in the knee, because we've gone over, if you haven't seen some of my videos in the past, on my surgery playlist, I have a bunch of videos on knee rehab for the knee replacement, and I go over the importance of regaining that knee flexion and extension. But when it comes to the squat, not only are we worried about the ability to flex and extend your knee, but mainly we're focused on also hip range of motion and ankle range of motion. So when I squat down, I have to have enough ankle dorsiflexion as well as hip flexion in order to sit in a squat, okay? So I might have good knee range of motion, but if my hips are tight, it's going to really allow me, when I squat down, my torso is gonna really lean forward when I sit down on surfaces. Or if my ankles are tight, when I go sit down, I'm gonna always wanna kind of fall backwards. And that's why it's important when we're trying to think about, in general, squatting, especially if we're using this for squatting as an exercise at the gym, we wanna make sure that we have the right range of motion in the ankles and the hips, and as well as the knee. Now, there are two ways that we can help achieve this or help work on this type of flexibility. And the first way is simply doing this at home within a doorway, supporting yourself with your arms just like so. Now, mind you, I'm sitting at the bottom of the squat. This took years and years to work on improving this flexibility, every day working on this. But some of you might look more like this, okay? And that is okay. We all have to start somewhere. So you're holding on and you're simply basically rocking back and forth, and you can work on this for about a minute or two, and then you might need to kind of take breaks and stand up and ensure that, you can take that pressure on the knee and on the ankle. And then if maybe this exercise where you're supporting yourself in this position is maybe too much on the legs, another way that you can help get some passive ankle, hip, and knee range of motion is by simply doing this kind of against the wall. So you might be in this position and you might be working on just trying to sit up nice and tall and seeing what it feels like to get your hips below the knee, if you feel comfortable with that, and to get these ankles to kind of flex, okay? I find that facing the doorway or holding on to something here is a little bit easier for people because they can kind of control how low they want to go when it comes to the flexibility component. So that is going to be addressing the flexibility component. Now moving on to the mechanics of the squat, because we have to know what is happening to the lower bone, what's happening to the ankle and the hip when I squat down. So most of the time when people say, yeah, I've done squats, my knees hurt when I squat, a lot of times it's a simple mechanics issue, meaning that, you know, their hips and knees are not doing what they're supposed to be doing when they're getting in this squat pattern. So for instance, you want to start kind of with your feet in a wide base of support. Now sometimes for individuals that can be narrow and they're able to really squat down at the bottom, but most of the time people are going to be about hip width apart, maybe even wider than that. So no one has a perfect squat stance. Every individual is going to be a little bit different here. So you'll start off with your feet about hip width apart, and as you're squatting down, notice that the tibia bone, which is the lower bone, is actually going to be tracking over the foot. I like to think second and third toe. One of the common mistakes you'll see people make is when they squat down, they're kind of just going down, they immediately think about just bending their knees. And so the first thing that happens is their knees come over their toes and their knees kind of cave in this pattern here. But the important thing to notice is that the knees are actually supposed to be going over the second and third toe, but also be thinking about driving your legs outward as you try to keep your torso upright. So that's what's going on with the lower leg, but also keep in mind what's happening to my hips, okay? Most of the time when people squat, they just bend their knees. They forget about what's happening at the hips, and the hips are actually going backwards and downward. And that's key when we're learning how to implement these exercises, is you want to do this correctly so that the weight is distributed through the knees equally and there's no extra unnecessary pressure that's being put on those knees, okay? Now, one of the best ways that we can teach people how to really use these mechanics when they're squatting, driving those knees outward, pulling those hips back, is by using a loop resistance band. So you can see here, some of these bands look like this. They have various resistance bands. This is a red one here, probably about a moderate size resistance. And I'm gonna wrap this around my knees. And with this loop, this can start to really teach me how to use my glutes to set my femurs and my lower bones in a good position while I'm squatting down. If I didn't have this band pushing into my legs, I'm just gonna wanna just sit straight down, not really engaging my glutes or engaging my quads. But this is a great band that can give you some feedback and to teach you how to use your hip and your glute muscles to incorporate them when you're squatting. Because if you don't know how to use these muscles correctly, your squatting pattern is going to be very difficult. You could have some pain with it. And this exercise is going to be a lot harder. Now, if you have the adequate range of motion and you don't have any trouble squatting down to a surface, the loop band can be a great alternative to start learning that squat pattern. And then over time, you can start to improve the ability to do this exercise and not need the band at all for that feedback. Now, the second way that you can perform this exercise and improve your ability to squat is by implementing box squats into your routine. So this is simply squatting from a box or from a chair. And this is usually a lot easier for people because instead of just squatting without no support underneath them, now they have something that they can sit down to and they feel safe and they don't feel like, you know, they're gonna fall backwards or they're gonna fall forward during the movement. The nice thing about this is you can still use that loop band around your knees and you can still practice standing up and squatting back down. And notice that the chair requires me and allows me to naturally sit my hips backward versus if I didn't have that feedback from the stool or the chair, I'm gonna immediately just wanna squat straight down. That's kind of the problem that most people have. So when you're doing this, you wanna make sure that, once again, your feet set up about hip width apart or wider, and you wanna make sure that you're kind of shifting your weight forward as you stand up onto your feet, you're standing up, and then most importantly, you start to bend those knees and you allow those hips to sit straight back, okay? Remember to keep in mind how you want those tibias to be tracking over those second and third toes, and you want to really focus on the alignment of your legs as you're going up and down into the squat. So we talked about how you can use the loop resistance bands to wrap around your knees to really start to allow you to engage your glutes as you're practicing the squat pattern. We then talked about how you can use a bench or a chair behind you to start incorporating some box squats. And then as you're improving your range of motion and the strength in your quads, then you can start to work on the next progressive exercise is by adding some more load, which can be done either with a kettlebell in the front rack position, or even if you feel confident enough, a barbell behind your head here. So you've mastered your ability to perform box squats, and you've mastered the ability to use the circle loop bands to be able to engage and activate some of your glutes now. And now you're feeling confident that you can start to add more weight with this exercise safely. And this is why I love using a goblet squat for that exact same reason. Holding a weight in this front position, I call this the front rack because you're holding something in the front of your chest here. Not only is it going to help you stay more upright, but it's really going to help you engage your core muscles when you're performing the squat exercise. So the way you would perform this is you would simply be using a light weight to start off with. Maybe that's 15, 20 pounds. You can use a kettlebell or you can use a dumbbell, and you're gonna hold it in this front rack position, and you're just gonna practice standing up and down. And practicing this movement here with the kettlebell is going to really allow you to focus on not only the squat pattern, but working on really standing up to a full position, working a lot of the quadricep and the hip muscles to really work on that stability and strength, okay? Now, those are my favorite tips to help give you the confidence and the ability to be able to squat again without any limitations. Now, if you want more information on how to improve your strength and your longevity with your body, or you want more information on how to rehab your knee after knee replacement, go ahead and check out my surgery playlist up here. But in the meantime, you can support this channel by giving this video a like, subscribe to the channel, and please leave a comment in the comment section below if there's any topics or videos you want me to cover. I'll see you in the next one.